A lot of people talk about precision medicine. It's a hot word these days. In precision medicine diagnostics, the goal is to be able to have new information for you at the individual level that work for you, that can guide your therapy, that tell about your disease, to tell about your disease progression. And right now with MRI, it's just not possible. You're going to get a diagnosis after the onset of your symptoms. If we're going to see anything in MRI, it's going to have to be really a gross abnormality. So we're limited right now to visual inspection by radiologists. We're limited to, anything that's larger than the pixel size, right? You need a collection of pixels to make some anomaly in this image, like a huge bleed, an aneurysm, a giant tumor. And these are the types of things we need to pick up. So our imaging modality is going to give you way more detail. You're going to be able to see better quality images that radiologists will actually judge as 10x better than gadolinium images. But the real power behind our technology is the insights that you get at each pixel in the image, where it's no longer just a meaningless intensity value, but actually a physiological measurement. And so at each pixel in the image then, whether it's in the brain or any part of your body, we're able to quantify the vascular structure, function, and leakage. And so what does that really mean? What are these biomarkers we have? So the vascular structure is really just a description of the amount of blood per unit volume. Is it 5% vascularized? Is it 6% vascularized? In medical imaging and MRI, we have a certain type of imaging that can tell you that there might be ischemia in your brain. We see those as white matter hyperintensities. But there's just no way now to quantify that ischemic burden. And white matter hyperintensities really are not a quantitative biomarker for precision medicine. We can quantify the function as well. And so when we're looking at quantifying the function, really what we're looking at is changes in the blood volume. We're looking at vessels that are dilating. So was it 5%? Now the blood vessels have dilated, now it's 6%. And so in particular, we're looking at the dynamics of vasodilation, and we do that with what's called a hypercapnic challenge. So we're going to have the patient on the table, they're going to breathe in a 5% CO2 and 95% air mixture. This gas-air mixture is so light that actually when you're breathing it in, you may not even be aware that it's changed from the combination of CO2 and air to, from just air. But we cycle this on and off. And so in that way, we're able to examine the vasodilatory response. It should take, for example, 6 seconds for your blood vessels to dilate. If it doesn't, there might be an issue. We quantify the amount of vasodilation. So this is called your vascular reserve. And your vascular reserve is very important because this is how much blood and how much metabolism can be made available to you. And as that disappears with time, you might run into a disease where suddenly you fall off a cliff because your vascular reserve is all used up. What we can also see is the dynamics of the vasoconstriction. So we'll turn on the CO2, we'll see the vessels dilate, we'll measure the dynamics of that, we'll measure that reserve, and then we turn it off and we should see all the blood vessels go back to normal, and this should be quite quick. So we're able to measure functional measurements as well. So we have the vascular structure and the vascular function, and we have the leakage. And for the leakage, it's blood-brain barrier leakage. It's not really bleeding, it's more insidious than that. We're looking at small gaps in what should be an impermeable barrier, and what we're seeing is proteins and trash products or whatever's in the blood can sort of float in past that impermeable barrier, past that blood-brain barrier, and get into the brain. Every single person who has mild cognitive impairment, now we know through group level statistics in gadolinium imaging that every single person will have blood-brain barrier leakage. But the current technology is limited that we can't show it at the individual level. And so Imaginostics has a transformative technology that can measure the structure, function, and leakage at the individual level for insights on you and your health and your own internal physiology throughout the whole body.